Good evening. Welcome to episode 16 of the Hope for Healing video podcast. I'm Dr. John Stracks, joining you from my office here in Chicago. I'm here this evening with a client of mine, Paul Szalko. Before I introduce Paul, let me tell you just a bit about Hope for Healing. It's a joint effort between the people at the Curable app and me. For those who aren't familiar with one or the other, I'm a physician in the Chicago area who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. Curable is an amazing app focused on that same goal. We've been working together since their inception about 5 years ago. A couple of notes before we get started. Paul and I will discuss his story for probably about 45 or 50 minutes, and then we'll spend some time taking some questions. If you do have a question for either one of us, go ahead and type it into the Q&A feed if you're here on Zoom with us, or into the chat on Facebook if you're watching us on Facebook Live. Curable is monitoring both feeds, and we'll get the questions to us, and we'll do our best to answer as many as we possibly can. Secondly, I want you to know that we now have the availability in my office to provide services around the world. So no matter where you are, if you're feeling stuck with your symptoms, feel free to reach out to my office through my website, www.drstracks.com. My staff will be in touch about how to talk with me directly about your situation. And lastly, just a minute to talk about the framework that we'll be discussing this evening in relation to chronic pain. Many of you know this as mind-body medicine, meaning that our body can express what's going on in our minds or in our lives. That's universal. Doesn't make us bad, it doesn't make us sick, it just makes us human. It only becomes bad if you enter a medical system that doesn't understand the concept and assumes that all physical symptoms are physical in origin. I believe that humans have always expressed our lives in our bodies, and we always will. And so our goal is to help you understand that and learn a little bit about what to do about it so that it's no longer physically uncomfortable or painful for you. With that, let me introduce Paul. Paul came to see me for the first time almost exactly 2 years ago. He started suffering severe back pain when he was 14 years old, was diagnosed with spondylitis at age 16. He experienced various symptoms off and on for more than 40 years, including IBS, anxiety, insomnia, cyclical vomiting, in addition to the back pain. Incidentally, as part of his healing, Paul was one of the very first people to participate in the Curable groups, which now has over 1,000 graduates and continues to grow. Paul, I am looking forward to having you share your story. And so let me say that I am equally happy to have had the opportunity to work with you over these couple of years and to have you as my guest this evening. Thanks so much for being here and joining me on Hope for Healing.
Thank you, Dr. Stracks. It's my pleasure to be here with you this evening and with everyone else on Facebook. And as you know, and as you introduced me, my history is quite lengthy. So I'm going to go through my story, and I just hope that everybody just kind of bears with me because it is long, but it's interesting. That's for sure. So as Dr. Stracks mentioned, my story begins 44 years ago. I was 14 years old, and I began experiencing low back pain. And when I told my parents about that pain, they didn't believe me, because who's going to believe a 14-year-old boy, healthy boy, is going to have back pain, in particular low back pain. And one day after I was participating in a racquetball tournament, I couldn't get out of bed. And when I did get out of bed, I couldn't stand straight up. So at that point, my parents couldn't be in denial anymore, and they realized that there was a problem. And so they took me to a neighborhood chiropractor, and we worked with the chiropractor. I worked with the chiropractor for about 2 years, and there was some relief, but it didn't resolve all the symptoms. And there were some times when I was okay. There were some times when I was in just horrible pain. And after 2 years, my parents had a meeting with the chiropractor, and he just said, I just can't do anything further here, and I really would recommend that you start to seek other alternatives. And so he recommended an orthopedic solution, and so that's the path that we went down. And so
I'm just doing the math. 44 years ago was 1976. There weren't a lot of neighborhood chiropractors at that point.
And this was a family friend. So
okay.
so it was somebody that we kind of knew, and that's why we had this meeting, which, doctors didn't do that back then either. So it was just kind of like, we're not getting anywhere, and we really need to start thinking about something different for Paul. And so, so then we started going to the larger medical centers in the Chicago area. And at that point, settled on an orthopedic doctor. And I went for bone scans, myelogram, and an EMG. And to this day, I am still convinced that an EMG is some type of medieval torture test. And quite honestly, the number of x-rays that I had to have at that time, because MRIs didn't exist. So I even joke with my family now that, I'm part radioactive, because I don't even know the number of x-rays that I've had. But finally in 1978, I was diagnosed with spondylolisthesis, and I had spinal fusion surgery, which was really the only way to correct that type of problem at that time. Today, they don't even do that surgery anymore, I've learned.
And so you had spinal fusion surgery at age 16?
Yes, at age 16. And after surgery, the doctor said that the only sport that I would be able to participate in was swimming. And, I was 16, and, I was stubborn, and I was a teenager, and I wasn't going to listen to what the doctor said. And I knew that football was not a good idea. So, I participated in what I could, and I just did it at a very cautious pace until I built up my confidence that I could do these things. And so post-surgery, though, I still continued to have back pain. It wasn't as severe. It was more muscular, and it just kind of ebbed and flowed, and it was just annoying. And the one thing that was really annoying was people were always asking me about my back, and they were always telling me that I needed to protect my back. And I didn't want to hear about it, but, it was just kind of the way it was, and I can understand people's concern. So from that point, then I went on to college, and then I started having stomach issues. And so then I was diagnosed with irritable bowel syndrome. And I was seeing our family doctor, and while he had diagnosed it properly, he just didn't know how to treat it. And so it was really, for those of you who have irritable bowel syndrome, it can be quite embarrassing. It really interferes with your daily life activities. And, and then again, I had to go for more tests. I was referred to another specialist, a GI specialist. He confirmed that I was irritable bowel. He got me on the proper medication, and then I was feeling better. But again,
and as part of your IBS, like, was one of the symptoms you were always had to be running to the bathroom and had to keep sort of in mind where the bathroom was? And
a lot of just stomach discomfort, just didn't feel well in general. So, so all of the above. So now at this point, I'm also told that I have a sensitive stomach, and I have a bad back, and I'm not even 20 years old. So, little depressing when you think about it. But at the time, I was still kind of, didn't really think much about it, just kind of kept going on. And when I was 21 and a senior in college, it was finals week, and I developed cracking and popping and tenderness in my joints, like everywhere, fingers, knees, shoulders, neck, everywhere. And that really scared me, because we do have a history of rheumatoid arthritis in the family. And at that point, that was really where I really got freaked out, because I was a senior in college thinking about joining the workforce. And now I'm thinking about some type of debilitating disease that I may have or may not have. And I was so afraid to tell my parents about it or to seek out medical treatment. And at that point, there was no internet, so there was no Dr. Google. So I just ignored it, and I just learned to live with it. And again, it just kind of came and went, and I just kind of just ignored it. And so, I think the other part of this whole equation that's really important to mention is that while all these physical symptoms manifested, there were definitely problems at home. And, my father suffered from anxiety, and he was in and out of treatment. And I was often the mediator during family disagreements. I was also responsible for looking out after myself, but, my parents and other family members, aunts, uncles that were elderly. So just, and this was a time when I was going to school full time, but I was also working full time because I had to put myself through school. So, I didn't realize it at the time, but there was a lot of stress and just there was a lot of activity, a lot of responsibility. And when I look back on that now, I didn't really think differently of it at the time. I just thought that was life. And, we were taught you just had to suck it up. You had to do what you had to do. So,
And you grew up here in Chicago, right?
I did, on the southwest side of Chicago. Yes.
And you had been, you and I have talked about this. You started working when you were 12, 14, like pretty early on, right?
14. Yes.
Yeah.
14. Yeah.
Okay.
So, and then, when I was 26 years old, my mother was diagnosed with metastatic breast cancer. So I spent a great deal of time caring for her, and she passed away when I was 30. And then things at home got worse for my father. And then I turned my attention from being a caretaker for my mother to being a caretaker for my father. But at the same time, I was also trying to establish my professional career in financial services. So again, just a lot of different stressors, and, and then, the IBS symptoms would flare or the back symptoms would flare. And so I was juggling all these different things all the time. And then in 1992, just before starting graduate school, I was diagnosed with anxiety after suffering months of insomnia. And fortunately, where I worked, we had an employee assistance program. We tried a couple of different things, and they just finally said, these things that we're trying aren't working, and we suggest that maybe you see a therapist and, someone that might be able to help you with this issue. And, I was just so desperate for sleep at that point. I was like, fine, I'm in. So, I started that, and, we started a treatment for that. So yet, another treatment, another regimen, something else that I was kind of trying to manage. And then,
and so just keeping score so far: back pain, spinal fusion, anxiety, insomnia, IBS, medication. And you're 30, how old were you at that point? 30?
I'm 30.
30 years old. Okay.
Yeah.
Got it.
Yeah. So, and then in 1995, I started experiencing random joint inflammation. So it wasn't the cracking and popping that I experienced in college. This was actually physically, you could see it. You could look at my knees, you could look at my fingers. They were physically inflamed. And then I was like, oh my God, that really set me for a loop. And I went to see a rheumatologist. And while everything that I was tested for came up negative, somehow they diagnosed me with ankylosing spondylitis, also referred to as AS in the arthritis world. Mm-hmm. And after I educated myself about the condition, then I was really scared. And I was scared for a number of reasons, because first of all, what this condition can do to you, what it can do to your spine, is not very, it's not very good. It's not very pleasant. What your life could be like as you age is not very good. And the other part about it is that from a treatment perspective, there weren't very many treatments available. At that time is when they just came out with the biologics. So we started with that. But there were only a few. And so I wasn't even sure how long they would last. So I joined a support group for AS. And, however, that group, for those of you who are already familiar with Curable, it's nothing like Curable at all. So, there was a moderator, but basically it was just a forum for people to complain, panic, get more anxious about their conditions. It was very rarely a place that offered hope or a usable or workable solution. And, so the only thing that I could do is I kept myself as physically active as possible, as this seemed to manage everything. It just made me feel good physically and mentally. And that was really kind of the only saving grace that I had at that moment. And so that's what I tried to do as much as possible. So I was always at the health club, just trying to do whatever my body would allow on that particular day. So, the other thing, that I mentioned that, I had to change my AS meds periodically as it appeared, my body would get used to them, and then the symptoms would flare. And again, the test results were always inconclusive. So their philosophy was, we're going to we're not going to treat you based on what the test results are, but we're going to treat you based on how you tell us you're feeling. And so that's how we worked it. But again, my biggest fear was I was running out of options. And at that time, I was on the latest, most recent biologic that you could be on. So if that one stopped working, I was out of luck. There was nothing left for me to do. So, and then during all this time, I was doing countless rounds of physical therapy for, various aches and pains and strains, and things would settle down and then they'd flare up again. And so, it was starting to become a very difficult lifestyle for sure.
And at that point, I mean, there's no reason you would have, but nobody had ever suggested through any of this. I mean, this had been a couple decades at this point. Nobody had ever suggested stress, what's going on in your life. Like that had never come into the conversation either between you and any professional or probably even in your own head. There was no reason to think about that.
And even at that time, there was never even really a connection between physical exercise and making you feel better. I mean, you were just maybe starting to read a little bit about endorphins and things like that, but there was nothing really much about it. So then fast forward to 2017, I woke up and both shoulders were popping and sore, and I couldn't exercise. And my anxiety started spiraling out of control to the point that I was sending daily notes to my psychiatrist, and we were changing medications rapidly. And I was either, not getting enough sleep, or I was so overly sedated that it was difficult to manage my daily activities. And so it was a horrible feeling, and it was horribly frustrating. And it was extremely difficult for me to put my wife through this. And I was becoming a foreign person, both to her and to me, because at this point I had no idea what was wrong with me. And I didn't even realize at that point that it was going to get worse. So in the beginning of 2018, I started vomiting. And then I was diagnosed with GERD, and the treatment didn't work. Then they diagnosed me with H. pylori, and that treatment helped initially, but it wasn't a long-term solution. And after more testing, I was diagnosed with SIBO, even though when I read the test results, it said I was negative for SIBO. But I mean, that whole process it was just so miserable that I just went with it. And at that point, I was like, who am I to question a doctor? If the doctor said, this is what it is, then this is what it is. So I went with it. And, they put me on a treatment, which worked for about 4 months. And then the symptoms would reappear and I'd have to go back on the treatment. So then I started getting into a place where, I thought, well, maybe I changed to a gluten-free diet. I mean, I was just desperate for a solution. So, and then once again, I was told you have a sensitive stomach. So like, okay, here we go back to this again. Maybe I do have a sensitive stomach. I don't know. And then in the summer of 2018, I was golfing, and I never did anything after a swing where I felt an injury or felt a tweak or anything. Got done golfing, went in the car, drove home, was probably in the car for about an hour. I could not get out of the car. Somehow I did manage to get out of the car, got into the house, called the rheumatologist. She ordered an MRI. No issues were identified. She suggested that I go for epidural injections in my back. And it was a series of epidural injections, which did not help at all. And then she sent me back to physical therapy.
And you had been diagnosed with AS a long time ago, but there were never any changes on the x-rays or MRIs. Like people with really bad AS, they get some arthritis in their sacroiliac joints, but nobody had ever seen that in you.
No, the only thing, and the good thing, my rheumatologist was very cautious when we went through the MRI results, because at that point she could already see that my anxiety was way up. And she was like, look, Paul, you're going to see things in here that says arthritis or degenerative disc. She's like, everybody has that. So don't even pay any attention to it. So, I really do give her a lot of credit, because that did, if I would have seen that, I probably, would have leapt to another, whole nother level of despair. So that really did help. But when she sent me to physical therapy, at that point, I needed to stop all physical activity because even doing physical therapy hurt. And so now everything has been taken away. So even the things that were kind of bringing me joy in my life at that time, which was, physical exercise, gone. Couldn't do it anymore. Couldn't go to my spin classes, couldn't do yoga, couldn't do Pilates, couldn't swim, completely gone. And then my anxiety just went way off the charts. And so much so that I had to take a leave of work, a leave of absence from work, which was completely necessary, but super humiliating. Because my doctors were like, you've just got to calm down. And you just don't need the stress from work right now on top of everything else while you're dealing with all these physical symptoms.
And you were a couple, 3 decades into your work career, right? I mean, you hadn't.
Yeah.
That's
right. And
I
traveled a lot on business. I managed large groups and teams. Yes. So, again, and taking a leave of absence is kind of not, while it is a benefit, you kind of get a check mark by your name. So I was concerned about what that was going to do to my career, quite honestly.
Yeah.
So, and yet after saying all of this, I still hadn't hit rock bottom. So, my anxiety calmed down. I went back to work, and then I started vomiting again, 2 weeks straight. And I could not retain any food. I was admitted to the hospital for a week of nonstop tests. I was sent home. I was still sick. And they gave me a diagnosis of cyclical vomiting. I'd never even heard of it. When I looked it up at that time, now I've got Google, so great, so Dr. Google says only kids get this. I'm like, I'm 50 plus years old. How can I get this now? So, again, I was given another medication. It seemed to calm down, and it would flare up every once in a while. So at that point, that's when things really went off the rails. And my ankylosing spondylitis flared, but this time in a way that was completely foreign to me. I started experiencing shooting pains all over my body. I thought perhaps that I was developing fibromyalgia. I just didn't know what was going on at the time. And, again, back to Dr. Google, at work, I couldn't sit in a chair. I had 4 chairs in my office because I had to figure out on a daily basis what chair was going to be comfortable for me to sit in. And then to your point earlier, Dr. Stracks, this is when the doctors, they suggested that there was a nerve problem and they prescribed more medication. And with all these medications, I was carefully coordinating my care with all of my doctors. So this was becoming a full-time job. Like, well, what does this medication do with all these other medications? And I'm 50 plus years old. I'm in my early 50s at this time. I'm taking more medications probably than an 80-year-old person. And I'm like, what is my life becoming? This is completely out of control. And, everything was being stripped from me. I couldn't do anything. I mean, it was just, I can't think of a word except to say horrendous. It was just so awful from day to day, and yet still trying to keep on. And then you've got all types of people giving you all types of different types of advice. And, you shouldn't feel sorry for yourself, and you need to get out there and you need to exercise. I'm like, yeah, I would love to, but I can't. And, but at this point, multiple doctors, after reviewing my records, started hinting about an emotional component. And, but they never said TMS. They never said mind body. They just said emotional component. And I was thinking about it, but at this point I had already started introducing transcendental meditation. And I'm like, well, wait a minute. I'm doing transcendental meditation, and that's supposed to help calm my nervous system. So if you're telling me it's emotional, then why isn't this transcendental meditation working? And so I don't get it. And so, I thought about it for a while, and then fortunately, and I don't even know how this happened, but I was on Facebook and I saw the Curable app. or I saw the ad. And initially I just dismissed it as just another empty promise on the internet. And, just like all the other ads that you see, but I kept seeing it, and something kept telling me that I needed to look into it. And I think at that point, I was so desperate that I was just looking for any straw. And so I was like, why not? And so I decided I had nothing to lose. I downloaded the Curable app, and that's when the healing journey started.
Wow. And that was what, late 2018 when
Yeah.
you saw that and clicked on it and downloaded the app. And so it had been at that point 40 years of unexplained symptoms, more medication, feeling worse rather than better, hitting rock bottom at the end of that journey. And so then you downloaded the Curable app and you started looking into it. And so what happened from there?
So I started seeing some of the things on the app, and some of the things that I was seeing were making sense. And I was having like a lot of, for lack of a better word, a lot of aha moments where I was like, wow, I'd never really thought about this. And then I was probably using the app for a little bit, maybe not more than 2 weeks. And then I saw an ad for Curable groups. And I was like, well, what's this about? So I attended the RSVP event, and I thought, well, the Curable app seems to work, but yet this is something that's 12 weeks, and it seems like there's going to be an accountability component. It's something that I have to commit to. It's something at night. I can do it in the evenings when I get home from work. What do I have to lose? And really, for the cost of what the program was, I was like, that's 3 doctor's appointments. And really, I'm not getting anything out of these doctor appointments. So why not give it a try? And so that's really kind of how I made the decision to move forward.
So let's talk about the groups a little bit. There are, a lot of people watching who are familiar with me or Curable or just getting curious, and some people watching who are either in the Curable groups or who have been in the Curable groups, but a lot of people haven't. And so Curable groups are patterned after some groups that I had run when I was at Northwestern Hospital, and then expanded significantly in terms of their scope and instruction. But why don't you describe for people what it was like to be in that group and sort of how things evolved over those 12 weeks for you?
So for me personally, I think, and I think a lot of people maybe feel the same way, but I think when you're dealing with any type of illness, and I think with the symptoms that I was dealing with for so long, and there were a lot of people in my life that were understanding and providing support, but yet, an illness like this, you can feel it's very isolating, because you feel like your body has betrayed you, and you have no idea. You knew what you were, and you have no idea how to get it back. And so with the Curable group, there was an immediate connection, because there were a group of us. I think there was 15. I don't remember the exact number of people that were in my group initially, but there was about 15 people. We had different symptoms. Some people had the same symptoms, but yet there was this immediate connection. And I think that was probably the most important thing for me, was being able to sit, on a call, on a Zoom call, and just be able to be with like-minded people who could understand what you were going through, and you can share your experience with.
And so then they had different modules, different information that you went over every week, and a facilitator to
Yes.
discuss it with you. And
Yes.
then how long into the groups did you start to get a sense that this was going to give you some relief?
I knew right away, for me, but because I had been through so much, you were one of the first people that we met with. You were our first guest speaker, and then I realized that your office was just walking distance from my house. So I was like, wow, I 90% believe that this is right, but I've been through so much. I just need that extra 10%. So, I met with you, you were like, yeah, and of course I came in with my, big stack of everything, and you were like, yeah, forget about all that. Let's just kind of talk. And then, you were like, I agree. Like, you know that this is what it is. I agree that this is what it is. And I remember that day. It was probably like, living in Chicago, we lived for the first really nice spring day. It was probably about 70 degrees that day. It was sunny. I think I was your first patient, your first appointment that day. I walked out of your office and I had a smile probably from ear to ear, because I was like, thank you, God, like that I finally found the answer and that I'm finally on the right path, because I was just completely lost. I mean, I was just ready to give up. And that's how low it got.
And do you remember from back then, that was a while ago now, it was a couple of years ago, but do you remember what it was that spoke to you? So people had been starting to tell you maybe there's an emotional component, but a lot of people who are listening, they've been to physicians and other practitioners who say things like that, but it kind of gets said like maybe it's in your head, or you're making this up, or you're pretending, and things that don't feel very good to people. So do you remember what it was that spoke to you, either what I said or Curable said or both, that made you say, oh yeah, I can see how there are these non-physical factors here?
So I think it had to do a lot with the courses, and it had to do a lot with the, the assignments that we were given every week. So we needed to listen to something, or we needed to read something, or there was another doctor that was there. So I think there were a couple of things that really spoke to me. So number one, when you were there, Dr. Schubner, Dr. Clark. So Dr. Clark with childhood trauma. And there are a lot of things that these titles to some of these programs that I was like, childhood trauma, what's that? I don't get it. And then I listened to it. I still didn't understand it. And then we started to talk about it, and some of the other people started to share some of their experiences in their life. And I was like, whoa, wait a minute. And then I was like, and then there were other types of things like self-compassion, inner critic, all the boundaries. Like, I was like, whoa. And just, even with Dr. Clark, when I compared my childhood to what he talked about, I just thought I had a normal childhood like anybody else. Like, we all have struggles. I just didn't realize, now I do, I didn't realize at the time the impact that had on me at that time, and then how that all moved forward. So, or how I carried that forward. And so it's all those things that kind of built upon each other. And again, just hearing all the various perspectives. And then I think the other thing that really clicked for me, so Nicole Sachs was also one of the guest presenters, and she was diagnosed with spondylolisthesis as well. So I was like, bingo, hold on a second. So wait, you mean I had a surgery that I didn't really need? Hold on a second. So then, and then what she talked about with her journaling and her meditation, for me, that was the thing that really clicked, because there's a whole lot inside of me that I really needed to get out.
Absolutely. And so just for those of you who are listening who have not participated in the Curable groups, Curable offers them entry into them once a quarter, and that's actually coming up in a couple of weeks. So anybody who's interested, you can go to curablegroups.com. That's their landing page for that. There's an RSVP button that you can attend their kickoff information event, which is Monday, March 29th. So coming up in just a couple of weeks. It's free to attend. If you attend, you get their new workbook, and there's no obligation. But so many of my patients now have found that the work in the groups is so helpful, just to, like you said, Paul, just to be around other people who are speaking a similar language and talking about it in the same way and sharing ideas, and not feeling like it was in that AS group that you participated in so long ago, where everybody was just complaining and it was pervaded with hopelessness more than anything else. So
right.
This is the opposite of that. So Monday, March 29th, curablegroups.com. So spoiler alert, Paul, you are feeling well now, but let's try to trace, that was still a couple of years ago. So for the people who are listening, let's try to trace how that happened and how that evolved. And so Curable app, Curable groups, information, you had come and seen me and I confirmed the diagnosis for you. And so what's gone on since then that has helped you move in the continued direction of healing?
So I think that the biggest thing is, when you start to learn this and when you've suffered as long as I have, and I think many of my fellow curable participants will say the same thing. It seems like you got the key to the kingdom and you want to just open the door and you want to get well as quick as you can. And unfortunately, it doesn't work that way. And, a lot of us have made significant progress. But some of us, we still have setbacks from time to time. And I'm no different. So I think that at the beginning, is definitely, 2 steps forward, 1 step back. There were a lot of things that we were learning and a lot of different things that we were trying. And, it's really interesting because prior to me learning about Curable, I never knew anything about mind body, never heard anything about mind body. And then within a couple months, I was completely overwhelmed by all the things that there are out there about mind body. And so it was really trying to find the things that, it was just, I was trying so hard to get well so quickly because I felt that I had lost so much that I was trying to make up for lost time. And, you're just going to get well, however it's going to happen. And there's no real roadmap for, what works for one person doesn't work for the next person. So you just kind of try different keys. And so you have to see what's going to work and what doesn't work.
And so you found that the journaling and the meditation were helpful, the groups, your groups still, they continued to meet even after the official program was over, right?
Well, one of the things that was interesting with our group is that as we got close during the program, many of us started experiencing significant progress. And what we were afraid of is that the program was going to end and then we didn't want to lose that momentum. And so, we talked to our facilitator and when some of the people at Curable, we thought, what could we do? So we decided that, we were going to continue to meet. And we have, we rotate who's going to kind of lead on a bi-weekly basis. And, we're continuing to do that. And then, during our, in between our meetings, we have an app that we use. We were using WhatsApp and now we use Signal, but we just use that as a way just for support. So if there's something that's happening, or sometimes people will say, hey, I just found this new meditation, you might want to try it. So sometimes it's informational. Sometimes somebody needs some, assistance and, we're just there for each other. So we're just kind of our own support group and it's worked out really well.
It's really nice. And then you had been seeing me fairly regularly to talk through some things. And I had started up a monthly group. Actually, I interviewed Leah and Brendan and Matt last 2 months ago, I think. And so you joined part of that group. And so you meet with a group of, I think there's 8 of you plus me, and do that once a month also. And how does that help you? How does that kind of interaction help you move forward?
So again, it really does help because again, you hear what other people are trying, you hear the progress that they're doing. And again, you're there with your support group of people that understand what it is to have this condition and what it takes to kind of overcome. And even if there are going to be, again, what we always talk about is that, recovery is not a straight line. And so what, and I think that for me was the biggest thing to reset my brain. I can't tell you the number of times that I would wake up in the morning with some kind of pain and I'd go right to my computer and I'm logging into my chart and I'm sending a note to my doctor. And now it's just kind of like, well, my knees bother me a little bit. Probably within an hour, it's not going to. So that's a complete shift.
Yeah. And it's so nice to have people who speak the language. People ask me all the time, like, how do you explain it to your family? How do you explain it to your own doctor? And sometimes there's good language and people will get it. But other times, people close to us, even in my own family, sometimes people don't understand what it is that I'm saying. And so that's why it's been so miraculous to be able to have these kinds of conversations with people all over the world. Because even if people sitting right next to you don't get it, there are literally millions of people around the world who are speaking the language, talking about mind body, using the app, using these principles. And in the last 5-7 years, it's become so easy to connect people who want to work on this together.
And the one observation that I will say is that, I have participated in Nicole Sachs' virtual retreat. Some of the people that from my Curable group, we were all going to go out to her retreat in California at Multiversity, and unfortunately, because of the pandemic, it was canceled. But some of us did her virtual retreat. But even as I participated in all these things, and as you talk about, doing emotional work and talking about feelings and things of that nature, almost everybody in these groups are female. So for all the men out there, don't be shy. Sign up and get involved. It really does help. It works. Don't be afraid, and certainly don't be embarrassed, because we're here to support you too.
Absolutely. And so what other resources have you found helpful? That's one of the more frequent questions I get from people who are listening. Is the concept is understandable for everybody who's here sort of by definition, but just learning the concept doesn't necessarily make people better. And so can you recall specific things that you have done that have helped move you forward? And so we talked about journal writing, meditation, groups, talking to other people. Have there been other strategies that have been able to either move you past roadblocks or just keep the journey going over these couple of years?
So for me, it's more about kind of just resetting how my brain reacts to things and how I react. So one of the things that I try to do is that I try to check in with myself to see how I feel. And when I say feel, I don't mean, am I in any pain, but just like, if I'm having a stressful day at work, how am I feeling about that? Or if I'm at home, how am I feeling about this or that, or an interaction with someone? How am I feeling about that? And I think that those are the things that I've completely overlooked that now I've learned that I need to revisit. And it doesn't mean that you have to address everything that's happening, but it just means that you have to have an internal awareness. And so I think that that is something that has been really key for me. And really, the other thing is just getting back to all the things that I used to enjoy doing before has been super helpful. So, last year I competed in an indoor triathlon. 2 years prior to that, there's no way. I started playing guitar again. So again, starting to have hobbies and activities. And, I know that's one of the things that Dr. Clark always talked about, and the things that bring joy into your life, being able to golf. Last year I did plenty of golfing. There wasn't much that we could do with the pandemic, but, I played a lot of golf and I carried my clubs a lot, which there's no way I would have ever been able to do that. So again, those are the things. And really what I'm experimenting with now is trying to take my, so, one of the things for me, I know is that when I commit to doing something, it becomes very regimented. And so I'm trying to experiment with, if I don't journal today, I'm still going to be okay. Or if I forget to meditate, I'll be okay. And so I'm just trying to break that. So, I always know that I have those tools, but not, I don't want to have those to be so life or death, like I'm really grasping, so that, if my day doesn't allow me to do it, it doesn't mean that the whole day is going to fall apart.
And what about the role of fear? So we talked about the role of emotions and getting a sense of how you're feeling. And so many of us grow up in families and situations where we talk about our thoughts, we talk about our intellectual capabilities. We get praised for being smart or logical. And one of the things that you had said was that learning to talk more in that feeling language is actually really important. What specifically about fear? How have you managed to decrease the worry about the symptoms that you feel in your body or any kind of pain signals that start to surface?
I would say that I don't recognize, so I do recognize them. And, sometimes the old patterns come back, and, again, for me, this is 40 plus years of this. So, just because I know this, it's going to take a while to kind of rewire things. So there are times when sometimes the old thought patterns kind of sneak back in, but I can recognize them and I can kind of say, stop, I know what this is, and just kind of redirect my thinking. Other times I just don't talk about it. The only time, things, my wife may ask if she sees me grab an ice pack out of the freezer, and I may just say, well, my knees bother me a little bit. But other than that, I don't think much about it. I don't talk about it. I know that it's going to go away. And I think, one of the things that you've taught us is to say that, whatever I'm feeling, it's emotional, it's not physical. And, so if there's something going on, that's just kind of the mantra that I kind of have going on in my head. And I said, I know that there's not anything physically wrong here. Just keep moving.
Yeah. One question I have for you, you had gotten involved in transcendental meditation. So you already had some meditative strategies that you were using. Do you have a sense, or can you articulate why meditation alone wasn't enough to get the pain to go away? Which is a question I get asked regularly.
Well, I think that the reason why I was doing the meditation was that I was looking for a result. And so I wasn't just meditating to say, I'm just trying to calm down. I was like, it was more like, if I don't meditate and if I don't do it 3 times today, then I'm never going to get better. As opposed to just saying, okay, well, I'm going to meditate now without judgment, without, without any type of expecting any type of outcome. And that's where I think I had it just a little backwards. So I was expecting an outcome.
Right. And so it's a concept we call outcome independence, of doing things that are important for us because they're important, not because we think that the pain is symptoms are going to resolve or calm down in that moment, but we do these things long enough over time and we see results. I also think that the meditation is very helpful for solving the issue of the symptoms, but only when combined with the framework. Only once we understand that the symptoms aren't physical in origin. There's nothing wrong with our body. There's nothing that, there's nothing in our body that's causing these, what we experience as pain. It's our body combined with our mind. And so these areas of the brain that amplify the pain and make it so much worse and turn on the fear and the worry and the Googling and the doctor visits. And so the meditation helps us to stay in the space where we understand that we can feel lots of things in our bodies that don't have anything to do with what's actually going on in our body, but have everything to do with what's going on in our lives. And so when I was at the University of Michigan, Dr. Howard Schubert and I proposed a pilot study on this for patients with fibromyalgia. And we went to talk to Dr. Dan Claw, who's one of the super nice guy, one of the world's experts, and one of his colleagues. And they said, okay, so what do you want to do? And we said, well, we want to explain to people that pain has this non-physical component to it. And then we've got this group and protocol that we want to run people through. And they looked at us and said, you can't do that. That's 2 things. You can only study 1 thing at a time. And Dr. Schubert and I looked at each other and said, but if you don't do both, then people don't get better. And so it's this combination of understanding where the pain is coming from and then applying the things that you're talking about, the support and the education and the the meditation and journal writing and talking things out and paying attention to feelings and emotions. But you have to have that framework first, or else the meditation doesn't do what we want it to do.
Right. Great.
So what's your life like now? What's day to day? What do you experience, and what limitations do you have?
So I think that, one of the things that I forgot to mention is that I am completely off all the medications that I've been taking. So, that was for those of you who might be on this journey, I used to spend my Sunday, probably took me 20 minutes or so over pill boxes, trying to figure out what pill for what day, at what time, what pills do I have to take with me to work. It was absolutely ridiculous. The only medication that I currently take are things that I can't control, that are not TMS, like for high cholesterol. So I am just absolutely thrilled that I am no longer on a first name basis with my pharmacist. That is one of the key things for me. And again, day to day, this past year, obviously all of us have been dealing with the pandemic. I've not had any issues or flare-ups because of the stress related to that. I've gone through a job change. I've not had any issues because of the stress associated with that. So there's just so many things that have changed. And it's just been really exciting. And, life is just completely different for me. I eat whatever I want. I don't worry about diet restrictions. Again, sometimes the old patterns want to sneak in. Can I tell you that I am 100% cured? No. Dr. Stracks, you and I had this conversation that, if you could wave a magic wand and make my pain go 100% away, would I want that to happen? And after I thought about it, I said, probably not. 10% probably is good to stick around, because it helps me. It's just kind of a barometer to say, hey, what's going on? What are you feeling? What do you need to journal about? What's going on in your life that you're not paying attention to? How are you feeling? So I think that that's kind of something that needs to stay there. And I hope it just continues to do the work that it's meant to do.
Such an important point, and I hear a lot of people say that after it. Sometimes it's confusing if you're just getting started in the journey, but after the fact, like Laura, who's the voice of Curable, did a really nice interview on her podcast with Christy Weepy last summer, who's a psychotherapist who does this work out in Las Vegas. And Christy talked about how she loves the fact that her body will stick up for her now. She goes through most of her day without any pain or symptoms. But if something pops up, she knows that it's her body's way of saying, slow down, spend more time with your family, don't take this extra client, go for a walk or a hike. And she loves having her body on her side, knowing that it will speak in this pain language that doesn't make sense until we learn to speak that language too. But once we've unlocked it, we can really take the symptoms and say like, oh, I think 7 o'clock, I think I need to go home. I can't stay here till 9 o'clock tonight, right, or whatever it is. So there are some questions stacked up that hopefully you've got some time to stick around and answer. I'm going to start with a couple of questions that come up frequently that you have some experience with, some of which you've touched on already, but especially the autoimmune disease. So you have a diagnosis of an autoimmune disease, an ankylosing spondylitis. How have you managed that as you've worked through from a mind-body standpoint?
So, I think, obviously when you and I first met, you told me that I don't remember if you gave me a percentage, but you said, I just don't believe that you have ankylosing spondylitis. And I didn't either, but, there was these weird inflammatory things that were happening, and I was having back pain, so I didn't know. And so, I did have, conversations with my rheumatologist, expressed to her what I was doing with this work. And, and then it was you and I in consultation that just decided we're going to stop taking the medication. And, that was one where I was just like, that one I did have a bit of an anxiety spike, because I was like, with these medications, if you stop them, you can't restart them. And, and I was on the last one. So I'm like, I hope we know what we're doing. And I have my two last syringes. I still keep them in the refrigerators, just kind of a reminder of where I've been, but never look back.
And as you've gone off all the medication, that's another question I get asked frequently. Was there a certain point in your journey where you felt comfortable enough to start to wean down on the medication?
Well, I never did it on my own. I mean, I always did it in consultation with either you or whatever other physician. I mean, there were so many that I needed to back off from. And, obviously some of them, there are some significant side effects from just, eliminating. So, there was a tapering down, and we just kind of did one at a time, and we just decided whichever one it was. And that's how we worked our way down. And so, it was great to be able to do that. I wasn't in any rush, but it was great to just be able to clear one out and then another and then another. So it was really just a rewarding experience from that perspective. But again, I would not advise that anybody just decide to do it without consulting with their physician. And, and one of the things that I've also had is every time I've gone back to my physicians, I've said, hey, I'm doing this mind body work, and and again, so this is going to come out completely wrong, but like there's a part of me that really wants to be angry about the 40 plus years that I've wasted. But there's no one to be angry with. Like, everybody was trying to be helpful. There wasn't like malpractice. Like, everybody thought that they were doing the best thing that they could. It was just that the Western medicine model it wasn't working for what this was. And so, so I had to work that out. And, so there is a part of me that still is a little frustrated. And that's whenever I meet people that are much younger than I am, I'm just, please do the work. Just please do the work and try it, because there's so much to gain.
I've been reading information recently about what's called acceptance and commitment therapy, which is a form of cognitive behavioral therapy. And there's some interesting information in there, which I sort of know intuitively, which is that you can't use essentially external solutions for internal problems. And so what that means is that you can get ahead in the banking world by being really forceful and just getting rid of the things that you don't like, right? Employees not working, get rid of them. Job that you don't like, find another one. And that's a way a lot of people work through the world, and people get really successful doing that. And then when it comes to things that are internal, anxiety, depression, pain, symptoms, dizziness, IBS, it doesn't work. Like, it's not a model that works. And that's why I think the conventional medical system, that's about like, oh, like, you've got a bacteria, let's get rid of it. You've got a spine that's crooked, like, let's fix it. And what people need oftentimes is a much different approach. And that's what this is about. And so I think that's why people get so frustrated in the medical system, because sort of these strategies work for problems that have to do with something else. But when the issue is inside us, we just need different strategies, gentler strategies.
Yes,
oftentimes.
Great.
Flare-ups, that's I get a question a lot about too. And so you've had some over time. Any thoughts for people about managing pain that hasn't been there and then decides to come back for one reason or another?
So, flare-ups, I sometimes I just have to watch out for the old patterns again, because I've been dealing with this for so long. It's easy for that to kind of that switch to flip back on. And so it's really something that that I have to be aware of. But the one thing that I really try to go back to is I go, think about all the things that you've overcome. And then I go back to some of the things that I've learned, and I kind of have a notebook of just some of the things that we've, learned in Curable, and just, thinking about the adversity, thinking about things that I thought were so horrible and they ended up being nothing, and just kind of resetting my brain to say, this is going to go away. And usually does.
Absolutely. Any other resources that you've used that we haven't touched on yet? There may or may not be, but anything else, books or apps or
You know what?
strategies?
I can't really think of, there's just so much information out there. And the only thing that I would caution people, so, I kind of knew this going into it. I know people in my Curable group are always recommending books. I've downloaded more books and they are collecting dust and virtual dust because they're all on my, Kindle or whatever. But I mean, I'm not a reader, so that doesn't work for me. So for me, it's podcasts or it's, for me, and again, I'm trying to strip things down. So I always listen to Nicole Sachs' Friday morning podcast. I follow her on Instagram as well. I have Curable on Facebook. Again, some of the things I try because some people are just beginning in this journey and I try to be helpful where I can, but then there's also times when I'm just like, I have to kind of back off from some of that a little bit. So, again, it's just, I'm still teasing out how much I need to be involved with it versus where I can just kind of live my life and just kind of give myself that space. So I'm still trying to figure that out.
Yeah, and I think a lot of people ask that too. They say, gosh, I'm like meditating an hour a day and I'm journal writing an hour a day and I'm focusing on this all the time. Does it get easier? I think your answer would be yes, it gets easier. And over time, you can put in sort of less daily work on it because your body trusts that it's okay and you don't have to be focusing day to day necessarily on like, what do I need to do today in order to keep this under control?
Right. Yes, absolutely.
You got time for a few questions before we go?
Sure, absolutely.
All right, so let me pull up the questions that have been stacking up here. So have you worked with anybody who's had success with cranial instability from a car accident? I think that question is for me, not you. And we've definitely had people who have had cranial instability, who have done this work and have had it done successfully. And so clearly that's somebody who I would want to have a full medical exam with and make sure that I felt looking at x-rays and MRIs and everything else was stable enough to treat it this way. But what I always say is that there's a physical component, there's an emotional component, there's a psychological component to every pain situation that people are in. And oftentimes the psychological emotional component is much bigger part of the picture than the physical component. And so whether there's an accident or an injury or a diagnosis, Paul, what's your thought at this point about the diagnosis of spondylolisthesis? Do you think that was relevant for you even at the time?
It was not. No. I mean, I think, sometimes I think, the doctor may have been tired of, he saw something and he just said, okay, here it is, we're going to go and fix it. And, knowing what I know now, back then my parents did what they thought was best. And so again, am I angry about it? Sure. But is there anybody to blame? No. So, it is what it is.
Next question, somebody has Dupuytren's contracture in his fingers and it's been getting worse, but you had swollen hands too at one point. And so what's your thought about swelling as it relates to mind body?
So, again, all those symptoms that I have had have gone. I mean, do I sometimes if something, do I have minor symptoms with it? Occasionally, but is it anything that's will really be disrupt my day? Not at all.
Yeah, and I've definitely seen what for all the world looks like a physical issue get better. My mother-in-law, hi Karen, if you're listening, a number of years or probably a decade ago had some contractures in her finger, essentially a trigger finger that was super painful, but it was 2010. It was in the aftermath of the recession, and she's a professor, and they were worried that the university wasn't gonna make it. And then as we kind of climbed out of the recession, it just never heard about it again. And so there's this big stress component and big life component to even things that feel like all the world must be physical in origin. Here's a question about IBS and food sensitivities in addition to eczema. And so did you ever try or were diagnosed with food sensitivities or try any elimination diets to deal with the IBS?
So, I did switch to gluten-free. And that had more to do with the SIBO than it did with the IBS. But at that point, we were treating multiple things. So, you know, I can't tell you that it really helped in any way. I think mentally, I just thought I was doing something that was helping. But then the problem is that then when you need to get off of that, you're afraid to put those foods that you used to enjoy back into your system because you're afraid something bad is going to happen. So, then you have to do just kind of the opposite. So a reintroduction diet. So I just kind of stayed away from that.
Yeah. And there's, I will acknowledge that some people don't respond well to gluten or dairy or sugar or soy. And so occasionally when I'm working with my non-mind body patients, we do talk about that. Sometimes people will come into my office with 40 and 50 and 70 food sensitivities. I think that's probably more of a mind body issue. It's not how our body's reacting to the food, but how we react after we eat. And there's definitely a mind-body component to eczema and other skin issues. There's a physician in New York City named Roy Stern Seidenberg, who I think was a patient of Dr. Sarno's at one point, used to speak on his patient panels, but he's a dermatologist. He does a lot of psychodermatology with people, and we can have some really good luck with people working on skin issues from a mind-body perspective. Somebody else had asked about environmental sensitivities too. So chemical sensitivities, I think there's a big mind-body component, and even allergies. Like any allergies that I had more or less went away after I learned about mind-body medicine. And Dr. Schubiner has a funny story that he was giving a talk in his hospital in Michigan, and a couple of days later, one of the employees came up to him and said, "I got to tell you this funny story." He said, I was at a party over the weekend, and I was in this conversation. It was really like, it took a dark turn, and the guy was telling me about all his mental health issues, and I sort of found myself wishing I wasn't in the conversation. And this employee said to Dr. Schubiner, said, all of a sudden I just started sneezing, like, achoo, 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 achoo. And finally he excused himself and went to the bathroom. And he said he looked in the mirror and he's like, whoa, like those sneezes really got me out of that conversation. And so there's a big connection between our brains and our immune systems, whether it's autoimmune disease or allergies, but I think we really have a lot more influence over it than we've come to believe over time. Let's see, those of us who power through even when suffering, don't cut ourselves slack until we're in desperate shape and can't function. How can we work to mitigate the impact of our personality traits that are typical of TMS? And so find faults and reassert themselves. Even if we know in our head that these play a role, they're still there. So do you identify any of the personality traits in you that go along with symptoms, perfectionism, self-criticism?
So you know what I mean? Yeah. So I think, as we talk about the type T personality, meaning the TMS personality, I've got them all. So, the perfectionist, the people pleaser, the anxiety, and then, never paying attention to my emotions. So, but part of that was just more, some of it was, I'm not sure if that was part of like my DNA or just kind of part of how I was raised, and those things just kind of evolved based on what you were taught and what you were told and how you were expected to act. And so, again, not putting any blame on anybody. This is just kind of where I landed at the end of the day. And so now I'm just trying to rework some of that. And, again, some of the things that we learned in the Curable group, like self-compassion, where I was like, what do you mean self-compassion? I don't understand what this topic is all about. And then, there you go, right there, that, I completely didn't understand it. So I needed to to understand and learn and pay more attention.
And I think, learning, even me learning more about the personality traits over the past year, I've been studying cognitive psychotherapy and training in it and practicing it in my practice, because that's what I've seen is so many people who the pain gets better, but still like the criticism and the perfectionism and the impossible standards are still present. And I think these days there are really good strategies to help deal with that. And I've worked with some people occasionally, like fairly quickly in a couple of sessions, we can put in strategies that really help to understand where the criticisms come from, calm it down, help to work on the perfectionism. And I think sometimes those symptoms are just, they're another manifestation of TMS. They show up because there's an uncomfortable situation or uncomfortable feeling that we're avoiding. And so if we dig down underneath, sometimes the perfectionism is no different than the back pain. But we're actually working on hopefully training and bringing on a number of coaches and psychotherapists, because I think that there are really good short-term solutions to a lot of the issues that stem from the personality traits. I think there's a lot that can be done much more quickly than people would imagine. Question about migraines. And so migraines is one of the more common symptoms that I see, and one of the symptoms that responds really well to this kind of intervention. And so our Hope for Healing landing page, where we'll post, Paul, this interview tomorrow, is curablehealth.com/hope for healing. And we've got two guests on those. Jessica Dixon was the first guest, and then Jill Rydell last summer, who have really had remarkable recoveries from migraine headaches, and both of them hundreds of migraines per year down to just a handful in any given year. And even then, when they get them, they're not scary. And so absolutely, I think migraines is well within this whole umbrella of mind-body medicine. I also have a short handout on healing migraines. And so anybody who wants to email our office at info@drstracks.com, we can forward you the migraine handout as well. But absolutely, I see migraines regularly and have worked with a number of patients who have done very well over time. Paul, here's a nice question for you. So how have your family and friends reacted to what you have learned over the last couple of years in terms of your experience? And the person who typed the question said that he finds that sometimes people can be a little bit dismissive, even when people are doing well.
So that's a great question, and it's something that I choose not to speak about, only because to the person who wrote that question, to their, everybody has their opinions, and I don't want to get into a debate about what I'm doing and why I'm doing it. I know that this worked for me. I know that this was the right thing for me to do, and quite honestly, everybody was concerned when I was sick. But now that I'm well, I maybe have one person that may ask the question occasionally, like, whatever happened to when you were, why were you throwing up all the time? And then I just say, it went away. And, I don't know, it just went away. And that's it, because people won't understand. And, and if I start going into the talks about, TMS and feelings, and and then it starts to get hippy dippy and all that kind of meditation and all that kind of stuff, they'll really think that I've gone off the deep end. So I've just chosen not to talk about it, and just say I feel fine.
And I think, everybody's ready to hear this when they're ready to hear it. And so even I don't force it on people, and I'll bring it up and I'll explain it. And I think telling our own stories is so powerful, but I recognize that, as I said earlier, not everybody is going to get it. And so it can be frustrating when, like, the person who's standing next to you, or the people who are standing next to you, are like looking at you quizzically, what's going on? But these formats and the ability to bring people together across time zones and across countries, like I said, there are literally millions of people out there who understand this, are recovering, are already recovered, are working on it, are working hard, have questions about it. And our ability to bring those people together and find a place where people can swap ideas and share stories and share insights and talk about struggles is such a leap forward for all of this. I think, even 10 years ago, it could be super lonely for people who are working on it. But these days, so many different options, whether it's Curable's Facebook group or Nicole's Facebook group or the various Curable groups, my classes and groups, so many different places to talk with people who understand this. Wow. A couple more questions. Here's another one about the Curable groups. The question is there more material than in the 90-minute modules? And so do you remember when you took it, what the structure was in terms of handing out information and then learning more about it?
Again, I think from what I understand is that there's been some changes from when, I've gone. So so we have continuous access to all the modules. And there were videos, and then there were writing exercises and things of that nature. I don't think that there are any more. At that point, they were 90 minutes, I think, because they were concerned about the imposition of people's time and their ability to get the assignments done. And so whether or not that's changed, I do not know.
I think there are 10 modules or so. There's a lot of information, and then the discussions where you talk about them. And then usually I and one other physician come in to answer questions during 2 different of the sessions. And so there's a good deal of material that gets covered in those groups. All right, 2 last questions. Curable's helped so much with the fibro and migraines, but now some IBS symptoms are popping up. And so any thoughts about A, handling IBS this way, and B, what to do if the symptoms start to move around a little bit?
So for me, the IBS symptoms have been resolved through this method. So yes, absolutely. And then I'm sorry, the second part of that question was?
When symptoms start to move around, and so you're doing well, and then all of a sudden something pops up somewhere else that hadn't been an issue before.
And from our conversations with Dr. Schubner, that's a good thing, because that means you've got it on the run. Mm-hmm. So it doesn't know where to hide, and so so again, just being able to just not pay it any mind and just kind of know that it's going to go away. And for me, there's been times when I've had various aches and pains, and then all of a sudden you don't even know it's gone until one day you think about it and you're like, hey, what happened to that pain that I had in my knee? And it's gone, and you just don't focus on it, and it leaves.
And then last question, do you have a sense of kind of timing on this? And so you downloaded Curable, you took the groups, you worked with me. Do you have a sense of sort of like how long it took you to start feeling a little bit better, and then how long to feel substantially better? Understanding, as the questioner said, and as I said, everybody's journey is different, and the timing and the healing pattern are very individualized.
For me personally, I would say that I started feeling better probably within 3 months, noticeably better within 3 months, significantly better within 6 to 9 months, where, then we started eliminating medications and things of that nature. Again, though, there was a lot of anxiety, or let me rephrase. So there was some caution around pushing myself to do things that I thought that I could not do. So again, when I started to get back into physical exercise, and my shoulder was still bothering me a little bit, but just pushing myself to get through it. And again, with that mantra of this is emotional, not physical. There's nothing wrong with my shoulder. And so those are the things that I just continue to challenge myself with. They pop up from time to time, and again, it's old patterns, but again, this is something that I've been experiencing for 40 years. So, and that's why I for those people who are younger that are going through this, I'm very envious.
Absolutely. And I get that question regularly too. Like, if it's been going on for 40 years, can I still get better? If I'm in my 50s or 60s or 70s, can I still get better? And I think you're a very nice example that like none of that matters. Once you understand the concept and start working on in this way, like you can make progress, and you can make substantial progress. Any last tips, any last thoughts before we sign off for the evening?
I think the only thing that I can say to wrap up is that you have to 100% believe that it's TMS, and you have to commit to doing something important for you. And for me, in my experience, I was doing so many things for everyone else, not knowing it, just thought that that was what I was supposed to do. But then I took a time out and I was like, wow, I really just need to do this for me. And I think the other part about this is, to the earlier question, that there's no right way to do this. There's no timeline associated with doing this. And it's just you just have to trust the process. You have to do the work. You have to stay committed and knowing that you're doing, something positive for yourself, and just be patient. And really, I guess that was more than just a couple words, but that would be my closing comment and what people should really keep in mind.
Well, thank you. And we will end there for the evening. Thanks so much for
Thank you
being
for having
here. Absolutely. And sharing your story and your wisdom. And I know how much people have appreciated your being willing to do this tonight. Thank you also to everybody who's been here and listening and asking insightful questions and sharing support. Every time we do this, I'm reminded of how blessed and touched I am to be part of this kind of community that's brave enough to work on these symptoms in such a creative and cutting edge way. As I said earlier, anybody who has interest in talking with me directly, you can contact me through our website, www.drstracks.com. My staff will get back to you with all the details and information that you need to know. And if you enjoyed this episode, you can find the recording later tonight or tomorrow, and all our previous episodes at curablehealth.com/hope for healing. You can sign up for our office newsletter and their newsletter to get updates and information about next episodes. And as I said earlier, those of you who are interested in the Curable groups can go to curablegroups.com. The information session is Monday, March 29th. I will be back here in 4 weeks on Wednesday, April 14th at 5 p.m. Central Time with another client of mine, Marian Froelich, who used mind-body medicine symptoms to recover from, again, years and years of chronic pain and other symptoms. So I hope you can join us on April 14th. Until then, please stay safe and healthy, and everybody have a good night.